Assalamualaikum students, welcome to my YouTube channel. Today we will discuss the most important topic, that is misuse of antibiotics and antibiotic resistance during COVID-19 outbreak. आज के लेक्चर में हम एंटीबायोटिक्स के बारे में पढ़ेंगे, एंटीबायोटिक की डिस्कवरी के बारे में पढ़ेंगे एंड misuse of antibiotics during viral diseases, particularly during COVID-19 outbreak. सबसे पहले एंटीबायोटिक्स. What are the antibiotics? The antibiotics, these are the antibacterial substances used to treat the infections particularly caused by the bacteria. Antibiotic, it is a chemical substance produced by certain microorganisms which is destructive, lethal to other microorganisms. Birth of chemotherapy. हम जब भी एंटीमाइक्रोबियल एजेंट्स के बारे में बात करते हैं तो सबसे पहले नाम आता है पाउल एहलिक, who was a Nobel Prize winning German physician and scientist who worked in the fields of hematology, immunology and antimicrobial chemotherapy. Among the foremost achievements, there was the treatment of the syphilis, one of the best achievement of the Paul Ehrlich, and he gave the idea, dreams of a magic bullet. Discovery of the first antibiotic by Sir Alexander Fleming. Sir Alexander Fleming was a Scottish researcher. In 1928 discovered the first antibiotic named penicillin. The penicillin was one of the first and is still one of the most widely used antibiotics. The discovery of penicillin antibiotic greatly reduced the death rate from bacterial infections, and he was awarded with the most prestigious award, Nobel Prize, in 1945. Great words of Sir Alexander Fleming. I did not invent penicillin, nature did that. I only discovered it by accident. When I woke up just after dawn, September 28, 1928, I certainly did not plan to revolutionize all medicine by discovering the world's first antibiotic or bacteria killer, but I suppose that was exactly what I did. Penicillium. Penicillium is a genus of mold fungi group from which the first antibiotic was discovered. This fungi is a ubiquitous soil fungi. Several species of penicillium are found to produce the antibiotic substances. The best example is Penicillium chrysogenum. Some species of this group also cause the food poisoning and produce the mycotoxins. COVID-19 outbreak. Almost everyone is well aware about the COVID-19 that was reported in Wuhan city of China in 2019, and it rapidly spread globally. That's why it was declared as a pandemic by the World Health Organization in 2020. This pneumonia-like disease was named as a COVID-19 officially, and it is caused by a virus that is a severe acute respiratory syndrome coronavirus. Use of antibiotics during COVID-19 outbreak. हमने लेक्चर में स्टार्ट से बताया था कि एंटीबायोटिक्स that are particularly used to treat the bacterial infections, not the viral infections. However, today also we will discuss in detail about the misuse of the antibiotics during the COVID-19. So here is a list of the antibiotics that were used during the COVID-19 outbreak. Among the antibiotics, the used antibiotics that were most frequently, that were the Azithromycin followed by the Ceftriaxone. Among all the antibiotics, the AZOMAX, that is the Azithromycin group, that was frequently used to treat the coronavirus disease. The other prescribed antibiotics were imipenem, piperacillin, moxifloxacin, ceftriaxone, and levofloxacin, vancomycin, clarithromycin and meropenem. यहाँ पे हमने स्टार्ट में बात की थी कि एंटीबायोटिक्स that are particularly used to treat the bacterial infections, not the viral infection. So if we look that there's a misuse of the antibiotics during COVID-19 outbreak, क्योंकि बहुत सारी reports confirm हो गई हैं. Even there are some reports they have been published, and they clearly reported that there is no any cure for the COVID-19 outbreak by using the antibiotics. तो यहाँ पे इनके जो consequences है, बहुत सारे जो एंटीबायोटिक COVID-19 में यूज किए, they may lead to the antibiotic resistance.